Hi, my name's Camille Carter, and my vulnerable population is survivors of domestic abuse. So this presentation, I'm going to examine statistics relating to this population as well as specific topics that make this population vulnerable. And I'm also going to discuss things that increase health disparities, particularly to this population. So this is just an overview of this population in general. According to the Domestic Violence and Abuse Help Guide, domestic abuse can be explained as a person that gains control over another person by means of physical violence, intimidation, emotional abuse, financial exploitation, along with many other factors, of course, depending on the situation. Victims can be any person of any age or gender. Unfortunately, domestic abuse does not discriminate. Anyone is at risk for abuse. Health disparity increased amongst this population is due to the fact that victims are heavily controlled by their abusers, and they may not have access to health care, treatment, and appropriate resources needed to maintain their health. So this is going to discuss the population size dependent on certain areas. Locally, I was unable to find solid statistics specific to local areas such as Davis or Weber County. I was not even able to find anything pertinent to northern Utah. However, I was able to find for the state that 2 in 11 women and 1 in 10 men are victims of abuse, according to a domestic abuse report. In the U.S., according to the CDC, 1 in 4 women and 1 in 9 men were victims of domestic abuse. And then comparing that to international statistics, I found on the World Health Organization report that more than 1 in 3 women and 1 in 7 men experience abuse worldwide. So with that being said, Utah has a slightly smaller population of domestic abuse survivors and victims. And I wasn't able to find a solid reason as to why this is so. I assume it's because Utah has a smaller population of people in general when compared to other states. So that definitely might be a factor that plays into this. So here are listed some specific barriers that prevent these individuals from having proper health. So access to healthcare and education is an issue for this population due to the controlling nature of the abuser. So these victims may not be able to utilize resources such as higher education and healthcare. Social support is often very limited for this population, again, due to the controlling nature of the abuser. So victims are often afraid to seek support, and they may not be able to have other relationships, again, depending upon the situation. Resources are also a barrier for these individuals because they may be restricted in the things that they can have or do, so they may not be adequately fed or clothed. Abusers may withhold other personal items from these victims, and some abusers also withhold finances and money, so these victims are unable to have access to their own funds, which definitely creates issues when being independent. Safe and quality housing is an issue because victims often live with their abusers, so they're unable to feel safe in their own homes. So these are specific concerns that this population faces. According to an article I found on the Joyful Heart Organization webpage, victims may experience these physical symptoms listed, and there may be more, again, depending upon the specific situation. Psychosocial things that can happen are many mental illnesses, low self-esteem, substance abuse, hopelessness, and suicidal thoughts and behaviors are increased in this population. Economic concerns, I touched on the financial issues, financial exploitation that may occur and lack of access to their own funds may definitely cause concern there. Unemployment may be an issue if this individual is prevented from going to work or due to the fact that they may not be able to focus at work because of that intense psychological stress that they are under. I was able to come up with 2 root causes as to why this population is vulnerable and why they are at an increased risk for certain health disparities. and that is definitely because of a lack of access to healthcare, social support, and other necessities, as well as injuries caused by physical abuse. So because these individuals are prevented from doing certain things due to the abusive and controlling nature of their abusers, they may not be able to go to doctor's appointments, fill prescriptions, reach out to people and support groups. They may not have things that they need, so that definitely has a negative consequence on their health. The injuries caused by physical abuse can also cause other health problems and concerns. So examining how these individuals and populations meet up to Maslow's hierarchy of needs, I found that for the most part, this population is able to meet physiological needs. However, depending on the situation, some individuals may not meet needs such as sex or sleep, because sleep disturbances can be quite an issue for this population. Safety, love, belonging, esteem, and self-actualization are definitely things that are unmet for majority of this population. With that being said, anticipated functional level could be partial physiological functioning or full physiological functioning, just depending on that situation again. So likely health outcomes, I figured that for majority of this population, they're able to meet primary survival needs, but they may be unable to achieve other tiers of the hierarchy like independence, which then prevents them from self-actualization, esteem. They definitely struggle with self-esteem, and love and belonging and safety can definitely be very hard for people of this population to achieve. So I found that this population is at an increased risk for communicable and non-communicable diseases. So according to the World Health Organization, communicable diseases that may occur are definitely sexually transmitted infections, HIV, AIDS, kidney infections, cervical infections. Again, if it's sexual in nature, those things are definitely a risk. Decreasing transmission of these diseases can be very difficult since abuse is not an easily prevented thing. However, if victims are able to go to the hospital, they can get treatment and drugs may be given to prevent unwanted pregnancy or STIs. Other drugs or treatment may be given to manage the symptoms of these diseases if the individual is unable to prevent the mentioned conditions above. So the non-communicable diseases, lots of mental illnesses, eating disorders, chronic pain, and much more. So those are just a few of the big ones I found. Prevention of these issues from occurring can also be very difficult if victims are unable to get help. The key is getting help, but again, most of these victims are highly controlled and unable to have that independence. However, if they are able to receive help, counseling, support groups, cognitive behavioral therapy have been shown to help manage symptoms and decrease occurrences. So self-care is definitely an issue and a barrier for this population, as I mentioned, due to a lack of resources and independence, due to the controlling nature of the abuser. Self-harm, it's shown that self-harm is increased amongst this population. So I found a really good article on this called When Survivors Self-Injured to Cope. So this discusses that it is common for survivors of domestic abuse to intentionally harm themselves as a way of coping with the stress. And it describes that self-harm can be an escape from stressful feelings, and it's a way for them to portray their emotions and their pain. Things that mitigate this harm definitely take time. A big thing that helped was cognitive behavioral therapy and counseling to reduce the risk of self-harm occurrences. So risk for harm is definitely dependent on the situation. According to the Domestic Shelter Organization, individuals who are abused are not guaranteed to become abusers themselves, but they do mention that there is an increased risk for abused individuals to either become an abuser or to be in another relationship with an emotional or abusive physically partner. So counseling, therapy, and proper treatment have all been shown to decrease these incidences. So here are my references. I had many for this presentation, and then I liked this. It says, break the silence to stop the violence. So it's definitely important to speak up for this population, since it's definitely hard for them to do so themselves sometimes. Thank you.